you are young, your body makes new bone faster than it breaks down old bone, and your bone mass increases. After the early 20s, this process slows, and most people reach their big bone mass by age 30. As people age, bone mass is lost faster than it's created. Bone is living tissue that is constantly in a state of renewal. New bone is made and old bone is broken down. Osteoporosis occurs when the creation of new bone doesn't keep up with the loss of old bone. It is a condition in which bones become weak and brittle. So brittle that a fall or even mild stresses, such as bending over or coughing, can cause a break. Osteoporosis-related breaks most commonly occur in the hip, wrist, or spine. What are the orthopedic implications of osteoporosis? Today on your regular health TV talk show, The Physicians, we'll be discussing osteoporosis, the orthopedic implications. Stay tuned. It's another day with The Physicians, where your health is our business. It's always a thing of pleasure and of interest, knowing that you are always there waiting to watch and listen to your favorite health talk TV show, The Physicians, and your health will always be our business. Today we'll be discussing osteoporosis, the orthopedic implications. My name is Dr. Martina Agbere, the regular anchor on this program. And with me is Dr.
Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business.
And of course, we'll always remain our business.
Our business, yeah.
So we're talking about osteoporosis, orthopedic implications. And oftentimes, whenever you hear this word, osteoporosis, you think it's just associated with the elderly.
Which is a big myth, and I think it's a dangerous mindset to just believe that it's for the elderly. In as much as we are both females, I will know that with females are more affected, but the truth is that people have to be aware that it can happen at any time. So
you know why it's most frightening, because the day tells you how the night will look like. So the things that you take, your kind of lifestyle, somehow has an effect on it.
And I think it's a lifestyle we really kind of be very vocal about it today, so that people will know that what you are doing now in your retirement, if you don't do the right thing, is waiting to happen to you.
And it also has to do with the bone mass.
Exactly.
Well, I'm very excited because we have
somebody
a guru who is going to talk about
who is always there's something we always take. Me personally, I always take something away, and I can imagine what our audience will definitely be gaining from today's program.
Well, let's wait for our guests to come on board, because if you are there just alone, please call somebody. And The Physicians has started, so that you can gain more, because it's not always easy getting these guests. He's like very, very hot cake. We're back after this short break. Stay tuned. Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. Today we'll be discussing osteoporosis, the orthopedic implications. And in the studio with me is no other person than our own very important guest. He is a consultant orthopedic surgeon, the MD, CEO of OSTEON Clinics, Dr. Akinola Bolarinwa. Welcome to our program.
Thank you very much.
You're welcome, Dr. Akinola. Always a pleasure.
Studio with the difference.
Absolutely. It's amazing to be here. Thanks for having me as usual.
Thank you. You're welcome. So I want to talk about osteoporosis and the orthopedic implications. Maybe if you will give us a general overview, what is osteoporosis, before we now deep dive into the implications?
Absolutely. Thank you so much. And I think you did a wonderful job in your introduction with the summary you gave. So I'm probably just going to be going over the whole thing, elaborating it a little bit more, just for everyone to really understand what we're talking about. So osteoporosis, again, a lot of medical terms come either from the Greek or the Latin. So osteo meaning bone, porosis meaning weakness. So it's a situation where there's a weakening of the bone. The bone becomes weak, the bone becomes brittle. But the most important thing is, why does this happen? Okay. It's almost like it's a continuation of a normal process. It's almost as though everybody, based on how osteoporosis happens, will eventually get to a stage where they will have osteoporosis. It's almost like that, even though we know it's not exactly the case for some other reasons. But why does it happen? The bone is a living tissue. And because it's a living tissue, it doesn't stay in just one situation. There's always new bone being formed, old bones being replaced. New bone being formed, old bone being replaced. And when you're younger and up to maybe your early 20s, you observe that the rate at which new bone is formed is quicker and much more than the rate at which bone is being replaced. So there's more new bone formation compared to old bone loss when you're younger. And by the time you get to about the age of 30, so from about your early 20s to the age of 30, that rate starts to slow down. By the time you get to the age of 30, you achieve what is called a peak bone mass. And this peak bone mass is occurring because of that bone build-up, which is faster than bone destruction. After the age of 30, you now start to have a gradual decline to the point where the rate of new bone formation is lower than the rate of bone destruction. So you're having more old bone that is not quite as structurally strong as new bone being formed. So this is what essentially leads to what we call osteoporosis. But of course, we all know that if we go for a test tomorrow, not everybody of about the same age or necessarily have osteoporosis just because of what's happening. So we know that there are certain factors that determine who actually ends up having osteoporosis and who doesn't. But in a nutshell, that is the cause, the mismatch between bone formation and bone destruction, where the destruction is not happening as quickly. Sorry, the formation is not quite happening as quickly. The destruction is still ongoing, and bone becomes weaker and more brittle. Yeah.
This is very, I think your explanation, there's nobody that wouldn't. You don't have to be a doctor, because even when you hear the name osteoporosis, it sounds very big. But the way you just broke it down now is so easy to understand. Formation, early age, and then of course, less destruction. But as you grow older, less formation, now, so it just means that, weakness of the bone, and everybody to an extent is as if you are programmed to have it. But we know, of course, scientifically with research and everything, not everyone we experience it. Absolutely. So at this point in time, I think it's also important for us now, because we made mention of the fact that not everyone will experience. So who are these people? What are the risk factors of this?
Absolutely. So the risk factors are where we now begin to break things down, and people can then kind of self-identify
where they belong.
Where they belong.
Because I want to identify where I belong.
I think I know where I belong.
In terms of risk factors, there are several categories. So we'll take them one after the other. There are some risk factors that are kind of fixed, unchangeable risk factors. So they're kind of fixed risk factors. And you know that within this subset, the chances of having osteoporosis is really, really high. So number one, let's look at age. As you rightly said, as you get older, you alluded to it before, a lot of people think it's a disease of the elderly. It is, but it's not only the elderly that suffer from it. So as you get older, the chances of osteoporosis is much higher, especially with the explanation that I gave. We look at the gender. It's more common in females.
Why now?
Yes, the hormones again. Maybe the hormones this time,
It's
right?
more common in females, absolutely. So I'm going to come to the hormonal aspect,
Okay.
but it's more common in females, especially postmenopausal women. So postmenopausal women particularly need to pay attention to the problem of osteoporosis. But if we take 100 Black African postmenopausal women to 100 Caucasian postmenopausal women, it's more common among Caucasians. Yeah. So which brings me to the next point, which is the ethnicity. Okay. So we know that in the Caucasian and the Asian population, there is a higher risk of osteoporosis than perhaps in our own population. Then we talk about family history. If you have a family member that has had osteoporosis, maybe they, and how do you tell? Most of the time, you have the situation where as people are aging, they just have a minor fall and they've broken their hip or broken their wrist or something like that. Even if they don't get tested, for me as an orthopedic surgeon, one of the things I'm questioning is there underlying osteoporosis going on here? So if you've had a family member that has suffered that in their old age, then it means that there's probably osteoporosis in there, and the family history increases the chances of you having osteoporosis. The other risk factors, of course, we have the hormonal, the sex hormones. As it goes down, the bones is more predisposed to osteoporosis, which is what explains the postmenopausal aspect in women. But also in men, if you're being treated for prostate cancer, you know, sometimes one of the treatments is you have your testes removed and then your testosterone level drops. That can predispose to osteoporosis as well. And of course, some other hormones, thyroid. People who are hyperthyroid take either hyperthyroid or taking thyroid replacement. If the thyroid level becomes too high, that can predispose to osteoporosis. There's some talk about the parathyroid and the adrenal hormones as well. And then we come down to things like steroid use. And this is where you see young men, especially bodybuilders. So there's hardly any bodybuilder that is not on steroids. If they're going to achieve the kind of muscle mass that everybody kind of wants to touch and feels really good. Exactly. You know, the unnatural parts. So a lot of them are on steroids, abusing steroids. And one of the long-term effects of one of the effects of the long-term use of steroids is osteoporosis. And so people just have to be really careful about that and be aware of that danger. Then there are metabolic causes as well. I mean, if you have some gastrointestinal problems, you know, like Crohn's disease, malabsorption syndrome generally, you're not absorbing enough. And because you're not absorbing enough, you're not getting enough nutrients, you're underweight, you'll have a small body mass. That's the one thing I missed out as well. People like myself with a small body mass, we're kind of more prone to osteoporosis than people who are much more stocky and bulky. So, so those are some of the risk factors. And dietary will be the last one I'll touch on. If you're not taking enough, for whatever reason, you don't have enough calcium intake, for whatever reason, you are not a proper diet, and you look at, especially for Dr. Kaduri, people with eating disorders that come to you regularly, you know, and if you have eating disorders, you're not getting enough nutrients, it means your bone is weaker. So those are some of the risk factors that predispose to osteoporosis.
You mentioned so many of the risk factors, and one is like, where do we belong?
You said you already know.
So I know where I belong. Okay. I'm talking about our audience. I'm sure they right now actually think
they're beginning
to put themselves in different places. Let's hear from the presentation. Dr. Akinola, let's talk about the presentation.
Thank you, ma'am. So the presentation, most of the time people don't have symptoms initially when osteoporosis is in the early stages. Remember that we're talking about this bone build-up, bone breakdown situation. But as things progress, some of the effects of osteoporosis starts to set in. And for me as an orthopedic surgeon, the three common areas where you have these manifestations is in the spine, in the hip, and in the wrist. And a lot of people get this in the spine. They're not even aware of it. And you suddenly realize that your 65-year-old aunt, you look shorter than you were before, 2 years ago. What's going on? It's probably because the bones in the back have started crumbling and she's reducing in height. and therefore that will lead to a reduction in height. So
That's
those are one of the
interesting.
things that can happen, and it can actually be painless. It may not be painful. For some people, it may be painful though. Those fractures may be associated with pain, and then they have a lot of back pain. And sometimes people come to my clinic with back pain. I get an X-ray, and I see that some of their bones have collapsed because of osteoporosis. They don't have any history of injury, any history of trauma, but the bones have crumbled because of the weakness in the bone. The other thing you sometimes notice is the hunching, especially in a lot of elderly women. People who used to walk straight suddenly are stooped. They have a stooped posture. And that stooped posture is usually, again, because of the effects of the crumbling. So you have a lot of spine manifestations that we see physically. And it only takes, people like myself investigating to say, okay, this is the reason for this. But there's also the fracture as well. Fracture of the hip, fracture of the wrist. From very simple falls. I may walk now and I just trip, and as I put my hand down, something like that maybe in my 30s, 40s, 50s would not be a problem, but the bone cracks just because from a simple fall, which it shouldn't. The moment we see that, we take a proper history, we know that, okay, this is probably a fracture due to osteoporosis. So it actually has its own classification. We call them osteoporotic fractures, because these are energies, or these are forces that wouldn't normally cause a normal bone to break. And it's not because, and the weakness is not because of anything like a cancer or something. The weakness is more because of the weakness in the bone due to these changes that happen in bone formation and bone breakdown.
This is quite interesting, because most time people may be looking at the fractures because it's fracture. They won't be looking at the one with regards to the spine, especially if it's not giving any pain.
Absolutely.
And I like the fact that we are breaking it down. But at this point, I'm sure also our audience is like waiting. Okay, now you have said these are the people that are at risk. Now you have said this one. How do we manage cases like this? And of course, how do we prevent?
Absolutely. Thank you very much for that. I'll quickly point to a point about, I mentioned steroid use before.
Exactly, yes.
And I mentioned bodybuilders. The other set of people that we kind of ignore are asthmatics. Asthmatics, they do the steroid inhalers. I mean, not all of them use the steroid inhalers, but some of them need the steroid inhalers. And we sometimes forget that this is constant steroid use. There are other people as well who, for one medical problem or the other, need to be on low-dose steroid use. Long-term use of steroids will always predispose. So at some point, we have to think about protecting their bone. So in terms of prevention, for those people, it would be a good idea to make sure that they're probably getting calcium and vitamin D supplements to help maintain their bone strength. In terms of prevention as well, exercise cannot be understated. Now, there is some theory to suggest that as part of the genetic aspect of osteoporosis, there's some theory to suggest that some people build so much of a bone mass during their 20s, 30s that they are not at risk for osteoporosis. But we know that exercise also helps this bone mass build up. And that exercise is meant to start in your 20s, really. Not when you're now much older. So that you're building up that bone mass over the years, and then you continue doing it as well. And what are these exercises? Walking, running, jogging, weightlifting. So even for the women, when you go to the gym, incorporate some weightlifting into your routine. Not any heavy weights, but at least something to just make sure that you're putting some...
So like strength building.
If you're at risk, if you're already at risk, okay?
The strength building exercises.
Yes, I'm just worried. Because when you were talking about the exercises, and if you're already at risk, and so suddenly you now have this fracture.
Absolutely. So it's a risk, but then again, so that's why it's advisable to start early, so that you're building this bone mass already, you're reducing your risk, and then you're continuing. And then
sustain.
What then happens is that as you build up this, as you continue your exercises, you're doing it in a safe environment. You're not overdoing things. At some stage, running may not work for you, but walk. Walk is much milder. At least it's better than just sitting at home, because having a sedentary lifestyle is another reason why people can't develop osteoporosis. So exercise is very important. Calcium And vitamin D supplement is very important as well. And finally, in terms of the treatment, obviously outside of the orthopedic treatment, because if you have a fracture, I have to determine, do you need surgery? Do you need non-operative management? And there are different surgical interventions that we can do to manage some of these fractures if it's necessary. Definitely for a hip fracture, it goes without saying that almost everybody with a hip fracture should be getting an operation, unless they are too unwell to have it. And even if they're too unwell, you should still try to do it for them for a hip fracture. For wrist fractures, not quite as much. Depending on the nature of the wrist fracture, you could treat it without an operation. For the spine fractures, if it's painful, there's some percutaneous techniques where you just inject some cement into the bone to help build up the bone strength and the bone height again, and that takes away a lot of the pain. Sometimes they may need surgery, and that's why I mentioned the percutaneous technique. Sometimes some people have so much pain from the osteoporotic collapse that you need to do some percutaneous surgery for them. Sometimes they need full open surgery. So it all depends on how they present, but there are options from non-operative to operative. But what is probably most important then is to get a proper diagnosis of osteoporosis. I appreciate in this environment because a DEXA scan is not widely available, and it's not, and it might be a bit expensive as well. People just treat osteoporosis based on the presentation. And they say, okay, the bone looks thin, you've had this fracture that fits into the osteoporosis picture, your circumstances, your personal circumstances fit into the category of somebody that could have osteoporosis, we'll just treat you anyway.
Rather than following the gold standard.
Exactly.
Yeah. Thank you very much, Akinola. It's always a delight having you as our guest. And trust me, because of popular demand,
we'll bring him back.
We'll bring him back to handle another very interesting topic. Thank you so much.
Thank you very much. All right.
And to our viewers out there, I'm sure you have heard from Dr. Akinola. We discussed osteoporosis, orthopedic implications, and he told us about the meaning of, just in summary, the meaning of osteoporosis. It just shows that the bones, as you age, they get weaker and become brittle, in the sense that anything can just lead to a fracture. So you need to actually know where you are, age-wise. For those that are muscle builders, you also heard from him on steroids. You know what to do. And for asthmatic patients that also use steroids most of the times, we also talked about it, and what we can do: calcium, vitamin D, and of course exercises. And to everybody out there, the benefit of exercise can never be overemphasized. Let's try as much as possible to exercise regularly. Not walk, not running, not racing, but brisk walk. Gently, we'll get there. On this, I just want to say thank you again for keeping the day with us on your regular Health Talk TV show, The Physicians, where your health will always be our business. My name remains Dr. Martina Agbere. The next time, stay blessed.
Thank you very much, Dr. Akinola. To all our viewers, thank you once again for keeping a date with your favorite Health TV talk show, The Physicians, where your health is our business. Now we heard about osteoporosis today. Please do the needful. Don't look at it as an aging disease. If you have had a family history, just make sure that for any time you are doing your annual checks, ask the doctors so that they can properly educate you. Be kind enough to follow us on all our various social media platforms. YouTube is there with over 200 videos. Please binge on them. For disinformation and misinformation, The Physicians is a place to be. And if you want to be a part of the show, just like Dr. Akinola, you are just a click away. Go to our website, fill the form, and you'll be right here. You don't have to be a doctor. If you have a story to tell to everybody in the world, The Physicians is the best place for you to advocate on that and change lives. My name is Dr. Nemuna Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.